Hi, I'm Tyler Shandro and I'm the Minister of Health for the province of Alberta. Now I'm pleased to be here today at the Wing Key Care Centre with Leah Lachelt, who's the Executive Director of the Christian Health Association of Alberta, and others from the Wing Key Care Centre, to talk about the government's investment of more than $170 million to help keep the residents and staff in long-term care and designated supported living, and as well as seniors lodges, safe from COVID-19. Now, these residents are at the highest risk of COVID-19 in our province, and the operators throughout Alberta are doing their best to protect those most vulnerable Albertans.
We're seeing much more anxiety and confusion among our residents. For example, instead of seeing a staff member coming in with a hug or a warm smile, they're seeing a mask or a shield, and it's very frightening for them. And so this funding has allowed us to increase our staff and increase the amount of time that our staff are able to spend with our residents to make sure that they're doing well and that we're able to monitor for any changes.
Now, it's essential that these facilities have the tools and the resources that they need to ensure the safety and the protection of their staff and their residents. The operators have rightly raised concerns about the cost of complying with the Chief Medical Officer of Health's orders, and that's why an additional funding of more than $14 million per month has been distributed to these operators to help cover the costs of things like enhanced staffing, as well as cleaning supplies and personal protective equipment, or PPE, and other costs that are additional precautions that are required to be taken as the outbreak occurs.
The operators are not only covering the sick benefits and pay of the staff members that are ill, but they're also needing to cover the cost of the replacement staff. So about 80% of all of our costs are related to staffing. So you can see that can become a very significant factor for operators. So this funding was really important to offset some of those costs.
Now, this funding is going to be retroactive to March 15th, and it's going to be maintained throughout all stages of our province's relaunch, and until the public health orders are lifted and the threat of COVID-19 in Alberta passes. We also know that the healthcare aides who work in these facilities are integral to the well-being of residents, and that's why our government introduced a wage supplement to help compensate our healthcare aides in the province for the extra work that they do that's necessary to be done during this pandemic. And the wage top-up is also designed to help alleviate the financial burden for those who normally work at more than one site, but are now restricted and can only work on one site. Operators receive these funds for the wage top-up on May 8th, and the payment to the healthcare aides is going to be retroactive, though, to April 20th.
You know, many of our healthcare aides are not the highest income earners, and so sometimes it's hard for them to see the value in what they do. The value is very intrinsic, of course. They're an incredible group of people that are working because they love their work and because of the heart and soul they bring to their work. But the additional funding for the $2 an hour top-up just gives them some additional recognition and often helps them stay in their position instead of perhaps looking elsewhere at a time of stress and a time of much more challenging working conditions. It's a way of enticing them to continue their calling.
And we're going to continue to work with these facility operators throughout the province to find ways to address issues as they arise, as we make our way throughout the pandemic, with the ultimate focus on safety for residents and staff. Our government is committed to continuing to strengthen the ring of defense around Alberta seniors, and we'll continue to work closely with federal, municipal, nonprofit, and private partners throughout the province to ensure that we are doing everything we can to protect Alberta seniors from the effects of COVID-19. Thank you.